Sir, please explain the benefits of omega 3.
Okay, so you want to know the benefits of omega 3, right? Prior understanding the benefits, let's understand how it will be beneficial for vegetarian and non-vegetarians, right? Basically, these vegetarians will get omega 3 from plants and seeds, and non-vegans will get it from fish or organic eggs or supplement called fish oil, capsule of the fish oil, right? Okay, now in what form it will be there in vegetables? It is in form of ala, and when you take non-vegetarian food like fish and organic eggs, you are going to get in form of EPA and DHA, right? Now whenever you are consuming ala, you need to consume 9 times more in compared to EPA DHA. If you are having EPA DHA somewhere 500 mg a day, then you need to take ala somewhere 4500 mg a day to make daily requirement. Clear? Okay, now as I mentioned, plants and seeds, right? So vegans will get it from flaxseed, right? 2 tablespoons. I am mentioning here tablespoon. And if you are taking oil, flax oil, then 2 teaspoons, not tablespoon now, when you are talking about the oil, right? Then if you are talking about the seeds, half cup walnuts, then 26 cups spinach, or 25 to 27 medium avocado, right? So this is large number, as I mentioned. You need to eat 9 times more if you are vegetarian, right? But the people who are non-vegetarian, they will get it from the fish like sardine, mackerel, salmon, right? And organic eggs. And then we have the option called supplement fish oil. Now, this good level of omega 3 good level of omega 3 reduces VLDL production. Reduces VLDL production. Right? Now, what is VLDL? Very low density lipoprotein. Right? This is made by liver. Right? So liver makes it. So this is also known as vesicle. This is VLDL. Okay, LDL. Now this carries triglycerol. Right? this is glycerol bone, and we have fatty acid. So this triglycerol is carried to the adipose tissue. This is fat cell. Fat cell. Fat cell synthesizes their glycerol bone, right? And this VLDL will release from here 3 fatty acids, right? Now these VLDL vesicles can clog the artery. They can get accumulated at one place and create a plaque. This plaque, these VLDL vesicles will accumulate here and create a plaque that is called fibrofatty plaque, known as disease called atherosclerosis, right? And this is going to be the most dangerous condition, right? Now, whoever having good levels of omega-3, this omega-3 will help them to reduce the VLDL production from the liver. So no more VLDLs and there is no plaque build-up then, right? Clear? Now, it plays a role of anti-hypertensive agent. Now, what is anti-hypertensive agent? Suppose this is your artery here, right? And artery do have their own endothelial cells. These endothelial cells responsible to release endothelial cells responsible to release NO, nitric oxide, right? And this nitric oxide has two functions at this point. It will dilate the artery, so no more constriction, and there is it is playing the role of anti-hypertension, right? And this will clear the gap which is accumulating some kind of material which is going to cause you some constriction, right? And this material is cleared by nitric oxide. Nitric oxide will remove and keep your space which is in between the endothelial cell. So thus this is going to play a role of anti-hypertensive agent, right? So good level of omega-3 again going to build up nitric oxide in your arteries. This nitric oxide is made by endothelial cell. They have the nucleus. This dot is called nucleus, and this nitric oxide will dilate the artery, as well as this is going to clear some material which is in between the endothelial cell, right? Again, one more example we can take from the heart, that fibrosis. Any patient or any client has scarring in their heart, right? So this is your heart, and heart is and the scarring, right? Scarring, or there is LVH, left ventricular hypertrophy. What will happen? Sorry, this scarring will accumulate type 1 collagen fiber, right? And this is going to build up fibrosis. But if a patient have good levels of omega-3, then this fibrosis is reduced, right? So you get good heart health with these good omega-3 levels in your system, right? Now, what about this cell membrane? Suppose this is a cell and there is a nucleus. This cell membrane, okay, let's enlarge it here. Cell membrane has phosphobilipid layer. These are phosphates. These are phosphates and they have inside lipid layers. Right? If they are relatively straight, then they are saturated fat. But if they have bend, a kind of bend, then there is nice fluidity, that is unsaturated fat. So this section I am showing here is because of good levels of omega-3. You find a bend. This bend is called cis, a bend, right? Due to this bend, there is a nice fluidity in the cell. If you stand straight near each other, there is no space, there is no chance of movement. But if you have a bend at this elbow, then you have a nice space for the movement, right? So fluidity is better at this point. So cell membrane, which is this, I have enlarged here, right? This is going to have nice fluidity onto the cell membrane, nice signaling mechanism onto the cell membrane, right? One more, anti-inflammatory. We have understood anti-hypertensive response from the omega-3. Let's understand what is anti-inflammatory. Right? What is anti-inflammatory response from omega-3? If you have any cell, take any cell. Suppose this is your cell. Right? This is your cell. And this cell is under attack by, suppose this is your bacteria. Right? Or virus. You know there are different shape of viruses, right? Suppose this is virus. Whenever the cell is under stress, whenever there is attack from the virus or bacteria, the cell is under stress. In that condition, this cell is sad and trying to release nucleofactor kappa B, right? What is this? Nucleofactor kappa B. Now, what is nucleofactor kappa B? This is an expression, a gene expression for cytokine production. So, this is a gene expression for cytokine production. And if there is a cytokine production, that's going to destroy the cell, that's going to inflame the cell. But the good level of omega-3, good level of omega-3 will go into the nucleus of this cell. Okay, so this is nucleus. Right? So whenever there is good level of omega-3, omega 3 will go into the nucleus and inhibit the expression for these cytokines, right? So once nucleofactor kappa B is inhibited, so there is no more cytokine production and there is no more inflammation at that cell. That is called anti-inflammatory. I hope I have simplified this lecture. Thank you very much.